The truth is, I went into medicine with really good intentions, and so did all these doctors. Doctors, nurse practitioners, medical providers. We go in to heal. We go in to help people. We go in because we are service oriented people. We are pleasers. And that's at our heart where most of the healers that you're dealing with are. But the problem is that most of us have gotten to the point where we're completely burnt out because we're not in the business of healing anymore, practicing conventional, regular allopathic medicine.
Mhm.
And that's what they tell me all the time. I am so frustrated. And this is not just in the US. We have physicians reaching out to us from Canada, physicians from Australia. Currently, we have provider certification program going with providers from Canada. So it's not just US as well. Other countries are reaching out to us because physicians in other countries are telling us the problem sometimes feels worse. Last week, we were talking with two of the providers who are either going through or have been through our certification program. And Kathy was mentioning that, and Dr. B was also mentioning that, in Canada, thinking about other tools besides medicine or surgery is considered taboo. It's considered almost like witchcraft.
Mhm.
And regular doctors, even if they're like family medicine doctors who know that functional medicine is scientific based, are like saying, but in this country, if I were to practice it, it would be considered like I was practicing voodoo medicine. I would possibly complain to my medical board. I could be investigated as being practicing out of the bounds of my training. Well, they kind of are practicing out of the bounds of the training, but
Right,
there's
right.
also a bias against functional medicine because there's a misunderstanding globally about what the hell that really is.
They're looked down upon. They're almost like an outcast if they try to take this approach. And really is so backwards because what you are advocating for and saying is, hey, take this approach because this is what works. We know how to get to what works. We know how to get to the root cause of the problems and
Mhm.
not just perpetuate some of those things you talked about, like prescription mills and not having the limitations
Mhm.
that are set in place for doctor patient relationships. Because I know that's a big complaint as well, is these limitations that are placed upon them.
Yeah, so here's something like, and I'm going to share my own story around this because, hey, I've got a lot of shame around my own ignorance when I was trained as an MD and how I treated patients coming to me who are asking for better solutions. So I'll give you an example. I'm trained at UCLA, one of the top medical schools in the country. I graduated the top 2% of my class at UCLA. I went through a family medicine residency. I was a wonderful, caring, and productive family medicine physician who became medical director, and I trained young physicians how to be better family medicine physicians. The way that we practice is based on follow the money, everybody.
Mhm.
How your doctors are being compensated directly impacts on the kind of care and the choices and options they give you and their training. So what that meant was, in a day we had to see 20 to 30 patients. At most, really, we could do is try to be in face to face time. The most we realistically could do was maybe 15 minutes, most of the time, way less than that. And then we had to come out and we still had to do probably 10, 15 minutes of additional paperwork on each patient. Think about that. That's an 8-hour workday. In an 8-hour workday, and typically it's not an 8-hour workday. I probably worked about at least 12 to 14 hours every week because of the amount of charting that I did when I went home. Think about this. When you as a patient come into our clinic, you're thinking, number one, there's time. Number two is because this is a doctor and it's a good doctor, they're going to know all the variety of ways to diagnose, treat, or they have all the tools that they can offer me to deal with my symptoms. But I'm going to ask you out there, is that your experience, and do they?
Well, let me share this with you. You were talking about the time limitations and how you get paid. My son's pediatrician appointment one time lasted over 15 minutes. It lasted about 22 minutes. They charged me for 2 appointments.
Yeah, because it is volume. If your compensation is based on volume, time is money. Each new patient that you can see is money. And that is how we earn our livelihood.
I was blown away. I couldn't believe that I wasn't able to
Well,
talk to
why
his.
can't you believe that?
It
Wait
was
a minute.
jarring.
I'm confused why you guys are confused out there. This is how you pay physicians, and then you're upset this is how physicians charge, or this is how physicians behave, because we are paying time for money. This is how we're compensating physicians. In the United States, over 95% of physicians are employed. Okay. They're employed by organizations that you guys fund with your insurance companies. We are completely at the mercy of the organizations we work for and the insurance companies that compensate them. So we are slave to the clock. We are
Mm.
slave to what we are considered billable services and what's billable and what's not billable. Why is anyone surprised that you're being billed by units of time or that you are being rushed out if you're at the end of your time?
Well, and it is just not conducive to getting your questions answered and feeling like you're going to have a solution and feel well. And, then Dale also was saying, are they compensated for pushing different tests or different medications?
Correct.
All of these play into what the doctors are up against. And it's like you said, most doctors are getting into this industry because they want to help. They're getting
Yes.
burnt out. They're getting, yes, all of the jaded with everything that goes into the medical field in this way. So there is a lot of factors working against them.
Well, here's the thing. Now you have well-meaning physicians like myself and like the hundreds of people that have reached out, providers that have reached out to us. We come down with our own mystery illnesses. How many of
Mhm.
you out there are listening that are in the medical profession, some way, somewhere in healthcare delivery, and you yourself started to come up with these illnesses and symptoms that are more challenging to diagnose or treat? We're not talking ear infection or a broken bone where it's like boom, boom, this is that. Okay. We're not talking about that. But how many of you have POTS, dysautonomia, dizziness, chronic fatigue, tachycardia, racing heart rate, hypertension, hypotension, fluctuating blood pressures, all these allergic reactions? How many of you in hormonal hell, and you're being told you're the medical provider yourself, and you start going to seek care and you're getting the care that you delivered yourself. We're starting to taste our own medicine now. My job as a medical doctor with the 15 minutes I have is as quickly as possible, based on your symptoms, figure out which blood tests or radiological studies you need, and boom, next. And then
Yeah.
when you come back to review the results, you have A or B. And if it's A, you're going to get this medicine or this referral. If it's B, you're going to get this medicine or this referral or this procedure. And if it's C, we don't know. Let's get you on an antidepressant, birth control pill, or therapy, or let's tell you to lose weight and exercise because they'll get you out of the office in 15 minutes.
Goodness forbid if you ask any questions then either, right? Because there's no time. There's just no time.
Well, so here's the thing. We are training physicians and compensating physicians and providers to be very efficient in that time frame to diagnose the quickly, easily diagnosable, that have an easy pill solution or
Yeah.
referral solution that gets them out.